we want to look at what we call incidence of these diseases, particularly severe disease, which is what we care about. We care, if we turn COVID into something that causes colds or mild flu, that's okay. If we can keep people out of the hospital, if we can keep people from getting severe complications, and if we can keep them from dying. Israel shows this data the right way, and I think we're going to see in just a second from Jenny that North Dakota is going to try and do this as well. What we want to see is incidence in the different groups. What does severe disease look like in the unvaccinated versus the partially vaccinated versus the fully vaccinated? And here Israel reports this in the most at-risk group, people over the age of 60. And you can see that people who are fully vaccinated are creeping up there are some cases of severe disease that are creeping up, but still vastly lower than those who are not vaccinated. That's a 9-fold difference. You are far, far better off being in that vaccinated group if you're looking to try and avoid severe illness. This is now being seen and data is being reported the way we would like to see this. That gives you the best sort of understanding of it. This was just published in that Morbidity and Mortality Weekly Report, the CDC's journal, from a study of the hospitalization rates. Here again, severe illness in LA County. And you can see this is the vaccinated, the fully vaccinated, the dark blue line. And yep, there's a teeny bump up in cases of people being hospitalized amongst the vaccinated, but still quite low. Whereas those who are unvaccinated, the black line is just going up and up and up. Here, it's a 29-fold difference. And you know, the kind of headline from that article was, unvaccinated had 5 times more COVID infections than the fully vaccinated and 29 times more hospitalizations than the fully vaccinated. Far, far better off being in that vaccinated group. So then the other question comes up is, what about booster shots? So we know that people who are immunocompromised, who have conditions that make them less able to mount a good immune response, are at greater risk for not responding to the vaccine. So when you compare antibodies made after vaccination in healthy healthcare workers, 98% will make good antibodies compared to people with HIV infection. Depends on their stage of HIV, but actually not bad. Autoimmune diseases down to 84%, solid tumors or cancers 82%, but the big risk groups are people with hematologic malignancies, that's like lymphomas and leukemias, down to 55%, and people who've had organ transplants down to 37%. So these folks are at very high risk of not having a really good response to the vaccine and therefore being still unprotected to COVID that's circulating in the community. And because of that, the Advisory Committee on Immunization Practice, the CDC's guidance committee, recommended that for people with moderately and severely immunocompromised states should be eligible for a booster dose of the vaccines. That includes active treatment for solid tumors and hematologic malignancies, receipt of a solid organ transplant, that's like kidney transplant, liver transplant, heart transplant, and still taking immunosuppressive therapy. People who are on certain types of drugs for during stem cell transplants, that's like a type of bone marrow transplant, and are still within 2 years of their transplant and taking immunosuppressive therapy. Moderate or severe primary immunodeficiency diseases, these are severe immunodeficiency diseases. Advanced or untreated HIV infection, and people who are on high-dose steroids and some other drugs that suppress the immune system. These folks are eligible to get a booster shot of the vaccine and should seek that out. Kind of looking at this again out of Israel, which I think is a few months ahead of us in things, much more vaccinated, but big Delta surge there. You can see here when you look at severe cases again, there's a big difference by age group. So the red here is how many cases there are. This isn't adjusted for the who's in that group. How many are on? Oh, I'm sorry. This one is adjusted. This is per 100,000 people in each of these groups. So this is adjusted for the population in each of the groups. Unvaccinated, high rates of severe disease, and it goes up if you're older. I mean, if you're over the age of 50 or 60 years old and still unvaccinated, you're really taking a great risk. And you can see, though, that the vaccinated, the green here, also have a bump up in severe cases, especially if you're in your 80s or 90s. So this is kind of why we still are thinking about needing to be careful, looking at needing booster doses, particularly with our elderly, even if they may be vaccinated. You may have seen in the news announcements from the White House that the Biden administration announced that booster doses would be available for Americans 8 months after vaccination, starting around September 20th. I think a lot of people in public health thought that was maybe jumping the gun a bit. We usually like to see the CDC's Advisory Committee on Immunization Practice issue guidelines. I think they will. We were hoping that they were going to do that with their meeting next week, but it doesn't appear that that's on the agenda. And so we're probably going to be waiting for formal guidance on this. I think it's probably safe to say, with the Biden administration announcing this, that some form of boosters are going to be more widely available by late September.